This is the Agricultural Training Institute. We are the training arm of the Department of Agriculture since 1987. We are the premier institution managing the country's extension services. We uphold leadership in agricultural extension through our network of 16 training centers located at the heart of rural communities across the country. We equip extension workers, farmers, and other key players in agriculture with outcome-based knowledge and skills. Our services are anchored on 6 thematic platforms of our core functions. We synergize agriculture with informed and capable professionals, the farmers, the fishers, and their families, infusing them with knowledge, developing their skills with the mindset to make a difference in their community. Our passion to serve finds fulfillment as we inform, support, and sustain the growth of urban and rural communities. We connect with partners in agriculture to uplift the human capital and hasten socio-economic progress. This is the Agricultural Training Institute today. We are providing excellent extension services beyond boundaries.
This is the Manila Bulletin, traversing time and truth since 1900, the newspaper with a century-long legacy of standing witness to the country's history and development. The Manila Bulletin's strong commitment to delivering news and information to the Filipino nation is a testament to its role in nation building and empowering the Filipino people. The Manila Bulletin tells timely stories and timeless truths. And this is its story. At the beginning of the 20th century, at the heart of the sprawling New American Center in Southeast Asia, 2 Americans, Carson C. Taylor and H.G. Farvis, organized a shipping and commercial publication and called it the Daily Bulletin. It was renamed as the Manila Daily Bulletin in 1906. In 1957, the Manila Daily Bulletin became a Filipino-owned publication after it was acquired by Menzi & Company. Its publisher, Hans Menzi, laid the foundations of the broadsheet as the exponent of Philippine progress. In 1961, philanthropist and business tycoon Dr. Emilio T. Yap was elected director and vice chairman. Don Emilio was named chairman of the board in 1982. Under his leadership, the Manila Bulletin was ushered in a new era of journalism to become the nation's leading newspaper by investing in a computerized editorial system, the first in Asia, and started publishing its full-color issue. Today, the Manila Bulletin is headed and managed by Chairman Basilio Yap and Dr. Emilio C. Yap III. The Manila Bulletin continues to chronicle the Philippines' current events and milestones. During the Japanese occupation in 1942, the Manila Daily Bulletin was forced to stop its operations, and in 1945, the Carriedo offices were reduced to rubble during the brutal Battle of Manila. When the late President Ferdinand Marcos declared martial law, the Manila Daily Bulletin ceased its operations once again, but after 2 months, it reopened and was renamed the Bulletin Today. In 1977, Bulletin Today upgraded its printing facilities, moved into its own and current location in Morales Street in Intramuros, and diversified its reach through the Philippine Panorama, its Sunday magazine, and Tempo and Balita, its tabloid publications. As readers are in search for more diversified and specialized content, the Manila Bulletin launched several magazines and digests, such as Agriculture, Animal Scene, and Going Places. It also acquired local and vernacular favorites, such as Liwayway, Hiligaynon, Bisaya, and Banawa. The Manila Bulletin transformed itself into a multi-platform media provider and innovated the newspaper reading experience by integrating special executions in its publications, including a 3D edition, NFC, QR codes, pop-ups, false covers, and belly bands. The Manila Bulletin also opened digital platforms such as a website, app, and e-paper. Its website is one of the most visited and trusted Philippine news websites in the country. Its Facebook and Twitter accounts and YouTube channel are one of the most accessed in social media, engaging the young generation of news and information consumers. Today, the Manila Bulletin strives to make the nation be fully informed, at the same time uplifting the Filipino spirit through There's Good News Here. This is the Manila Bulletin, and the Manila Bulletin will continue to inform, inspire, empower, telling timely stories and timeless truths through this century and beyond.
Good morning mga ka-friends and welcome! Kay anian usab kita sa ikaduha nga episode sa atong programa AgriTalk 2021. Our health, our body, our priority. Dinhilang sa Agricultural Training Institute Regional Training Center 10 official Facebook page, ATI Northern Mindanao. By the way, I am Mark Sabin Epi ang inyong host for today. O naka-streaming kita sa atong Facebook page ATI Northern Mindanao, DAATI, Agriculture Magazine, Smart Community, and Manila Bulletin Facebook pages. Apan sa dili pa kita mapadayon, ano na kita'y mga pangutana. Tubagan ninyo kini aron makadawat kamo sa atong mga premyo sama sa cellphone load nga 100 pesos, t-shirt, mug, ug uban pa. Ayaw ka pala ka kung layo ka mo, kay amo kini ipadala sa atong mga courier. Ang mechanics, kinahanglan naka-like ug naka-share sa atong Facebook page sa ATI Northern Mindanao. Naka-register ni ini nga programa sa AgriTalk 2021 o mo-comment karon ini nga episode. Send ang inyong tubag sa atong Facebook page through private message o dili dinhi sa comment section. Ug karon ang atong mga pangutana. Unsa ang 5 ka mga nag-unang sakit sa tibuok kalibutan nga maoy kasagaran nga hinungdan sa kamatayon sa tawo? Again, ang first nga pangutana. Unsa ang 5 ka mga nag-unang sakit sa tibuok kalibutan nga maoy kasagaran hinungdan sa kamatayon sa tawo? The second one. Unsa nga sakit ang usahay gitawag og mother of many diseases o nga naman? Again, unsa nga sakit ang usahay gitawag og mother of many diseases o nga naman? Okay, sa may aging episode, gisgutan sa atong resource person ang bahin sa paglikay sa COVID-19, hypertension o heart disease. Nagpakita usab siya og mga recipe sa pagkaon nga angay natong sundon. And now, brace yourselves mga ka-friends kay karon nga episode hagaisgutan sa atong resource person ang bahin sa diabetes, obesity o kining pagsubra sa atong timbang o ang cancer. Ug unsay buhaton aron malikayan ang maong mga sakit ug unsaon pag-manage niini. At ang iusab ang mga recipe sa pagkaon nga i-suggest sa atong resource person aron makadugang sa atong pagalutuon sa atong pamilya. Magpadayon ang atong resource person sa may-agi nga episode, usa ka doctor o specialista sa lifestyle medicine. She has been with family medicine for 14 years and now in lifestyle medicine for 9 years. Presidente siya sa Remnant Institute Incorporated, President sa Philippine College of Lifestyle Medicine. Dili na nato langanon. Please welcome Dr. Michelle Acero Palma.
Typical day be the key reason for your poor health today. 70% of all deaths are now attributed to lifestyle choices. And thanks to obesity-related health issues, this will be the first generation to live shorter lives than their parents. We all know the solution: move more and eat better. But we also know the power of bad habits. How do you change an entire lifetime of unhealthy choices? You can't do it alone, but there is help. Heart disease, cancer, diabetes, and high blood pressure. These diseases, virtually unknown 100 years ago, are now responsible for 3 out of 4 deaths. Today, obesity is the #1 health concern in the Western world. Sadly, our unhealthy lifestyle isn't just affecting adults. Obesity and its lifelong health consequences is now the top concern for children. But what hope is there for children if parents are settling for a life of medications, dialysis, angioplasties, and bypasses?
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
Clearly, our indulgent Western lifestyle isn't working. But how can we change? Did you know that lifestyle diseases aren't just preventable, but also largely reversible?
Today we will be discussing about disarming diabetes. So, if you would notice, doon sa mga existing na mga patients who are developing fatal conditions in this time of pandemic are those that have the pre-existing conditions nga. These are the leading cause of death worldwide. So, 5 ito kung titignan natin. So, included here is cardiovascular disease, respiratory disease, cancer, diabetes, and stroke. Now, this is the data from the World Health Organization, but this is also true in the Philippines. Okay? So, if you notice, all of these 5 are all lifestyle related. Yes, we have the infectious disease right now, pero kung titignan natin, this top 5 cause of death, it's also coexisting with a communicable disease. And more so, kung meron ka nitong mga communicable disease na to, this poses you more to the risk of developing fatal condition when you get infected with the current COVID-19 right now. Now, I have here the data from the Department of Health. These are the top 10 causes of death in the Philippines. So they were able to report this in February 2019. And you will see here that 24.4% of the death is caused by disease of the heart. Now, baba ako kaagad dun sa diabetes because that will be the topic for today. So yung diabetes comprises about 6% of the death. Okay? So total death. Now that is the report from the Department of Health. Ngayon, I'll show you another data here coming from the National Statistics Office or the NSO. So they are relatively the same, looking at it. Yung pinakamataas pa rin na cause of death is ischemic heart disease. So ito yung may mga bara sa ugat ng puso. And then diabetes is right there. Now, I want to show you the numbers. This was reported in June 2019. Okay, so the reported deaths in 2017 is about 579,237. Okay? So, kung ita-translate natin yan, the average would be about 1,500 to 1,600 deaths a day, per day. So, kung gusto natin ng per minute, ibig sabihin, may isang taong namamatay kada minuto sa Pilipinas. Alright? Now, let me bring you to the numbers again. Okay, so here is the number. If you will see in your screen right now, the number of daily deaths in ischemic heart disease is over 200. To be exact, this is 230 deaths secondary to ischemic heart disease daily. Okay, let me go down to diabetes. In diabetes, 85% is dying every single day of diabetes. Okay, so I'm not discounting the effect of COVID-19 because it's really necessary because this is an acute condition, this is a pandemic, but lest we forget the non-communicable diseases, mas magkakasakit pa rin at mas mamamatay pa rin ng mga Pilipino. Alright? Now, going back, again, there are about 85 Filipinos who are dying every single day of diabetes. This is diabetes, okay? Now, you might be asking me, why would I go straight to diabetes? Yung number 1 cause of death pala is cardiovascular disease, okay? Now, you will see here that diabetes, we call them sometimes as the mother of many types of diseases, no? Because looking at the complication of diabetes, just because they are affecting the blood vessels that would supply all our organs from head to foot, ibig sabihin, ang complication niya is also from head to foot. Okay? So our eyes may be affected. Patients with diabetes may develop heart attack, stroke, peripheral artery disease. Yung mata apektado, they may develop cataract, they may develop glaucoma, diabetic foot, they may develop diabetic nephropathy, yung kidneys affected, and then they will also have peripheral neuropathy. Okay, so they have numbness, they have pain on the extremities, so on and so forth. Okay, so yes, number 1 cause of death is heart disease, but mind you, ang diabetes is really atherogenic. So let's discuss diabetes this time. So diabetes is included in those chronic diseases. Now, bakit natin uumpisahan sa diabetes? Now, you will see in your screen right now that diabetes is in fact declared as an epidemic in the Philippines since year 2019. Pag sinabi mong epidemic, eto, no? In fact, if I were to say, diabetes is a pandemic because it's been affecting the entire world. Kung titignan mo yung statistics, konting-konti yung COVID-19 compared to diabetes statistics that we have. But it's just that yung infectious disease kasi is an acute condition that we have to take care of it right away. Yung diabetes naman, ang pagkakaiba, this is a chronic condition and most patients with diabetes don't really feel anything, you know, until they are diagnosed with diabetes. And marami nga sa kanila sinasabi pa, I don't really feel bad at all. Yung labs lang nagsasabi na may sakit ako, you know. So that's why medyo hindi rin sila nai-encourage na mag-change, to change into a healthy lifestyle. Now, actually, in this time of pandemic, I am starting to appreciate, you know, the efforts na ginagawa ng mga tao ngayon. Kasi people right now are more health conscious than ever. They don't want to get the infection or ayaw nilang ma-include doon sa fatality. Now, like I said, Philippines now is facing an epidemic of diabetes. And if you can see in your screen right now, 1 in every 5 Filipinos are already diabetic or pre-diabetic. Ikaw na nanonood ngayon, baka hindi mo alam na diabetic ka. You will never know unless you get yourself tested. Alright? So, if this is 1 in every 5, bilangin mo kung ilang kayo dyan sa family ninyo. Okay? So if this is 5 adults living in one household, 1 among you may be diabetic already or pre-diabetic. So ngayon, pag-uusapan natin kung ano ba talaga ang diabetes. Kasi dati ang alam natin, diabetes type 1 lang, diabetes type 2. Pero ngayon, sa mga guidelines natin, may tinatawag na kasi tayo ngayon na pre-diabetes. If you notice, dati kapag nag-request ang doktor natin ng blood sugar test, minsan nakikita natin to na medyo above the normal limit siya. So usually, ang sinasabi natin sa pasyente is borderline na sila, no? So ngayon sa diabetes diagnosis, we already call it pre-diabetes. So sige, pag-usapan natin ngayon on kung paano mo masasabi na may pre-diabetes ka or may diabetes ka na. Okay? So ang makikita nyo sa screen nyo ngayon, you will see there, ito yung mga test na ginagamit natin to diagnose a patient na may diabetes. So ngayon, ginagamit na natin yung A1C, kasi yung A1C, yun yung nagbibigay ng average blood sugar natin in 2 to 3 months time. So doon natin nakikita kung controlled yung blood sugar ng pasyente or kung tama ba yung binibigay nating gamot, kung nagwo-work ba yung gamot sa kanya, or kung yung ating binibigay na advice sa kanya, ginagawa niya ba o hindi. Okay? So yun yung ginagamit natin. But usually, ang nakasanayan nating nire-request specifically is the fasting blood sugar or yung FBS. Okay? So ito yung fasting glucose. Minsan naman ginagamit din natin yung oral glucose tolerance test or minsan tinatawag din natin yung postprandial. Okay? So just to be clear, pag diabetic ang pasyente, the A1C should be above 6.4%. So, pag yung A1C nyo is 6.5, magbibigay na tayo ng diagnosis na diabetic na yung pasyente. Or kung yung fasting blood glucose natin or fasting blood sugar is equivalent to 126 or more than 126 milligrams per DL in 2 separate occasions. That means 2 beses. Kasi hindi ibig sabihin na 1 time lang yung nakaagad ng diagnosis. No? So, 2 beses natin kukunan yan. So, if it's equivalent to 126 or more, that means diabetic na yung pasyente. At yung OGTT naman, or minsan yung postprandial test, tinitake din natin, if it's equivalent to 200 milligrams per DL or more, meaning ang pasyente ay diabetic na. What are the symptoms of diabetes? Of course, marami kasing nagsasabi may diabetes sila but they don't really have any symptom at all. But we have classic diabetes symptoms. Okay? So first, frequent urination. Lagi silang umiihi. Second, feeling of thirsty. Lagi silang umiinom. And then, increase of appetite. They also have blurred vision and they always feel tired. So mamaya, mapag-uusapan natin bakit ito yung mga simptoma ng mga may diabetes. You will always see them inom ng inom. Why? Kasi yung sugar mataas sa dugo. Okay? So the sugar is hyper-concentrating in the blood, and so it needs to be diluted with water. Kaya inom sila ng inom. So since inom sila ng inom, they will also urinate frequently. So, bakit sila kain ng kain? Kasi yung sugar hindi pumapasok sa cells. They stay in the blood vessel. Nasa ugat lang siya. Hindi siya pumapasok sa cell. So, your body thought they are hungry, so that's why they keep eating. Okay? So, we'll discuss further on that. The blurred vision usually happens as a complication of diabetes. And of course, feeling tired kasi walang energy yung cell. Kasi nga, yung sugar hindi nakakapasok doon sa cells. Okay, so diabetics should be aware of the following. Apat itong lagi natin sinasabi. Number one, numero uno, is heart health. Because a diabetic patient may not die of, say, renal failure, but they may die of ischemic heart disease. Okay, yung number one cause of death. Why? Because diabetic is an atherogenic condition. Ibig sabihin, nagpapanarrow siya ng ugat ng ating puso. Okay? So, kumikipot yung ugat ng puso natin, hindi nakakadaloy na maayos yung dugo. Okay? So, that may cause ischemia. Number two, na dapat pag-ingatan sa diabetic patients is the kidney function. Alright? So, kasi madalas sa kanila nagkakaroon ng end-stage renal disease just because of long-staying diabetes. Of course, kailangan ipag-ingatan yung kanilang mata. Nakita natin doon sa complications kanina, yung pinakita natin doon sa screen, ano? So, they may develop cataract, they may develop glaucoma, and then they may develop also diabetic retinopathy. So, kung titignan mo, tatlong kondisyon kaagad yan, just because of having high blood sugar. So, if you were to think of it, is it really worth it? With all these types of complications that you may have, nag-aabang sa'yo yon, you know? Yung pang kakainin mo on your plate right now, just because of that appetite you have, is really worth it? No? Ang mahirap lang kasi ngayon, these complications doesn't really happen right away. So, hindi siya nakakatakot kasi matagal pa siya mangyayari. And actually, many patients won't appreciate the complications kasi nga, matagal pa siya mangyari. Alright, so diabetes is in fact a multifactorial nature. So, bakit nagkaka-diabetes ang pasyente? Genetics is one factor. So, pwedeng yung parents mo may diabetes, both sides pwedeng may diabetes, but we also have the epigenetic. When you say epigenetic, ano yung naging behavior ng mother mo when you were in the womb? Alright? But the thing is, we are not predestined to have diabetes. Hindi ibig sabihin na kung yung parents mo may diabetes ka na rin. Alright? Because what I'm seeing right now, basically in my practice sa clinic, kapag ako nagda-diagnose ng pasyente na may diabetes, say, nakita ko yung kanyang blood sugar, and this is the second test that we have, and then I would tell my patient, Ma'am, may diabetes na po kayo. I am expecting to see a sad face. Parang yun ang ini-expect kong makita sa pasyente na malulungkot sila kasi may diagnosis na sila ngayon. But, unfortunately, hindi yun na nakikita ko sa pasyente. Usually, I would see, may diabetes na ako. Alam mo, Dok, kasi yung parents ko may diabetes din. Tapos yung kapatid ko may diabetes din. So ngayon, ako na yung may diabetes. So parang tanggap na lang talaga nila na this time, it's their turn to have diabetes. It's not only the food intake, it's not only the lifestyle, it's not only the genetics, but this is multifactorial nature in the development of diabetes. Of course, included here is the lifestyle factor. Ano yung kinakain natin, yung diet, exercise, the stress level of the person, and some other habits na meron siya. Of course, environmental factor and microbiome also plays a role. Now, here, I wanna let you see in your screen, the epigenetics in type 2 diabetes. These are the key influencers. So, ano yung positive influencer in terms of developing type 2 diabetes? So, you will see here the polyphenols that you can see from plant food sources, yung vitamins, particularly vitamin B, exercise, stress reduction, and then the healthy diet of your parents will actually give you a positive result. Alright? So, ibig sabihin, mas mataas ang chance na hindi ka magde-develop ng diabetes kahit na may genetic predisposition ka. But what are the negative key influencer? Of course, number one is sugar. Refined sugar, alcohol, saturated fat, processed food, and the unhealthy parental diet. Kung ano yung kinakain ng parents mo when you were still in the womb while your parent is conceiving you. The key player in diabetes development, in fact, is the insulin resistance. Now, let me introduce you to your pancreas. Okay? Lapay sa Tagalog. Yung pancreas, katabi po yan, nasa bababanda ng ating stomach. Okay? So, katabi siya ng ating small intestine. Now, let's say this is a normal function of cell in your pancreas. So, your pancreas has beta cells. Yung beta cells na yun yung nagpo-produce ng insulin. Okay? So, pag kumakain tayo, ang nangyayari, yung insulin, para siyang susi, bubuksan niya yung door, yung pinto, para makapasok yung glucose or yung sugar. Now, what's happening with type 1 diabetes? Doon naman sa type 1 diabetes, ibang usapan yon. Kung type 1 diabetes, ibig sabihin, walang insulin. So, ang nangyayari, yung sugar nandoon lang sa dugo. Hindi makakapasok doon sa cells kasi walang presence ng insulin. The only way for them to survive is for them to have exogenous sources of insulin. Yun yung type 1 diabetes. Doon naman sa type 2 diabetes, which is common right now and which comprises 90% of all diabetes in the world. So usually, yung pancreas dito is working properly. But the patient is also usually overweight. Okay? Now, ang nangyayari dito is that, nandun naman yung insulin, pero hindi lahat ng sugar nakakapasok doon sa cell. Why? There must be something gumming up the door. Hindi makapasok doon sa lalagyan ng susi. If you can see right now in your screen, I have here a figure to show you. This is a very short video. Na like if you're eating spaghetti, right? Pag kumakain ka ng spaghetti, what will happen is that you will put this in your mouth, no? And then, what will happen, yung sugar dapat na napuproduce, kasi nga carbohydrates yung spaghetti, di ba? So, ginagamit kasi ng sugar, ng ating muscle cells, yung sugar, for example. So, bakit sa muscle cell yung pag-uusapan natin? Because dito nag-uumpisa yung insulin resistance. Okay? Dito nakikita yung insulin resistance, I mean. So, what will happen is that, pag tayo kumain, yung carbohydrates, pupunta dapat sa ating dugo, and then when it's in the blood already, lalabas yung insulin coming from the pancreas. Doon sa ating muscle cell, may tinatawag tayong receptor doon for insulin. You will see there in your screen, the receptor of the insulin. Didikit dyan sa receptor yung insulin. And then, it will activate series of reactions. Pag na-activate yung reaction na yun, lalabas ngayon yung glucose vesicle. Yun yung door kung saan papasok yung mga sugar. Coming from your blood, going into the muscle cell. Now, how about in type 2 diabetes? What you will see here is, nakita niyo yung insulin, dumikit na dun sa receptor niya. Now, supposed to be, ma-activate siya, right? But due to the presence of intramyocellular fats, pag sinabi natin intramyocellular fats, ito yung fats na nasa loob ng ating muscle cells. So, they are actually triggering toxicity inside the muscle cell that causes the receptor not to respond doon sa insulin. That's why yung daanan ng glucose, yung daanan ng sugar, hindi na-activate. So that means just because of those fat na nasa loob ng cell, hindi ma-activate yung daanan para makapasok yung sugar. So what will happen is that, here, this is clearly seen in your screen, yung sugar, nandoon lang sa dugo mo, wala sa loob ng muscle cell. Anong nandun sa loob ng muscle cell? Those are the intramyocellular fats. Okay? So what's the relevance of that? The relevance is that that causes insulin resistance. Ibig sabihin, maraming insulin na napoproduce yung pasyente, pero hindi nakakapasok yung sugar sa loob ng cell. And that is equivalent to having diabetes. Okay? Now, you will see here na yung intramyocellular lipid concentration actually decreases the insulin sensitivity of any individual consuming free fatty acids, fats, taba, mantika. Okay, clear. Free fatty acids in just a matter of 3 hours after eating. Approximately 3 hours after eating, and you will see in your screen kasi this is about 160 minutes, no? After about 3 hours of eating fats, taba, mantika, insulin sensitivity decreases. Nag-uumpisa na kaagad yung insulin resistance. Tanong, how many times are you eating in each day? 3. Madalas sinasabi 3. But honestly, marami sa atin kumakain 5 times a day kasi may 2 snacks pa tayo. Pero pa dun sa midnight snack kung minsan. Ano? Now, if you look at the 3 major meals na kinakain natin, if this is composed of saturated fat in particular, sa umaga, 3 hours after, bababa yung insulin sensitivity because of the presence of fats, right? Sa tanghali, kumain ka uli ng fats. After 3 hours, bababa uli yung insulin sensitivity. And then sa dinner, ganun din yung kinain mo, bababalin yung insulin sensitivity. And this will happen over and over again. And so, that is equivalent to developing diabetes type 2. Okay? Secondary to insulin resistance. Dati sa medisina, ang alam namin, what causes diabetes is the sugar. What causes diabetes? Yung asukal na kinakain. So right now, yes, this is the caloric load that you have, but unfortunately, what causes insulin resistance is the fat that we eat from the food every single day that causes insulin resistance. And I hope that's clear. Okay? Now, studies are showing that by age 20 years old, well-established na yung pancreas mo. Okay? Well-established na yung islets, the beta cells that produces insulin. However, just because of these free fatty acids, yung fats na kinakain natin, it causes death to the pancreatic cells. Alright? Just because of the lipotoxicity. Take note of that. So it's not only the increase in sugar that causes death to the pancreatic cell, but also the fat. More so with the fat. All right? So that in this research, it was found out na most probably yung mga nadadiagnose ng type 2 diabetes have already 50% decrease in number of their pancreatic cells. And over time, bumababa pa yan ng about 20% depende doon sa pagkontrol nila ng blood sugar nila. Okay? Now, bottom line here, the consumption of hypercaloric diet, for example, which is rich in saturated fats, in the setting of unfavorable genetic background, ibig sabihin may family history ka ng diabetes, this is equals to pathogenesis of type 2 diabetes. So yung 3 factor na yon, kung meron ka, magkakadevelop ka ng diabetes. No? I hope that is clear. You will notice type 2 diabetic patients started with a heavy weight. No, medyo malalaki sila, specifically may central obesity sila, pwedeng maliliit yung braso nila, maliliit yung binti nila, pero yung kanilang tiyan nandoon, nandun yung fats, yung adipose cells, nandun concentrated. So we call it central obesity. Okay? So now in this study again, that was conducted. This is the Nurses' Health Study, the famous Nurses' Health Study. You will see here, one of their findings is that yung mga nasa highest end ng weighing scale, ibig sabihin yung mga overweight, they develop diabetes 40 times higher in frequency than those at the lower end. Ibig sabihin yung ideal ang kanilang body weight. Okay, so in this study, this was actually conducted at Harvard, this is a systematic review and meta-analysis with over 200,000 people that they were able to track for a decade. So they were able to find out that when a person consumes approximately 4 ounces or 113 grams ng unprocessed meat, ibig sabihin karne, you know, ito yung mga unprocessed fresh meat na kinakain nila, when you consume 4 ounces of that every day, that will increase your diabetes risk by 20% already. Okay, so yun yung isang findings nila in this research. Now, another findings that they have, which is really very remarkable, is that if you took 2 ounces or 60 grams, tignan mo kung ano yung 60 grams, no? Konting-konti kasi yan of processed red meat per day, this will increase your diabetes risk by 50%. So yung 60 grams na kinakain natin na processed meat, that will pose you to develop risk of diabetes 50%. Napakataas nun. So, ano example ng mga processed meat natin? Ito yung bacon, corned beef, meatloaf, sausages, hot dogs. So, as long as you're consuming 60 grams of that every single day, so that increases your risk to develop diabetes at 50%. In your screen right now, you will see this is how it looks like when you put your muscle cell in the microscope. Okay, so you will see the fat droplets inside the muscle cell. So, dapat ang laman nito is glucose. However, due to insulin resistance, ang laman niya is fats. Okay? And so, typically, ito yung picture nung muscle cell nung pasyente na may diabetes. Okay, so much so about diabetes. What can we do pag ang pasyente may diabetes na? Now, let's start with researches again. Now, I will show you here some of the researches that utilizes lifestyle intervention. Ibig sabihin, ginamitan nila ng nutrition, physical activity, stress management, smoking cessation, and then adequate sleep. Okay, so this is one of the famous study na gusto kong i-present sa inyo ngayon, ano? So, kung yung mga doktor na nakakapanood ng ating presentation ngayon, alam na alam nila yon kasi this is what we call the Diabetes Prevention Program or we call it DPP. This is a 3 years program, 3 taong ginawa yung study, and in this study, they have about 3,000 obese pre-diabetic patients. So, ibig sabihin, itong mga pasyente na to, malalaki sila, matataba sila, no? They are at the obese category and then they are pre-diabetic, hindi pa full-blown yung diabetes nila. Now, in this study, they explored the question of drugs or lifestyle. Now, in this case, ang pinag-aralan nila is metformin. So, ang ginawa nila, hinati nila yung 3,000 participants into 3 groups and then they tracked them for 3 years. Tinignan nila kung ano yung magiging clinical outcome. So, ibig sabihin, ini-investigate nila kung sino yung grupo na magkakaroon ng full-blown diabetes. Sino yung mas marami? Yung group 1. Yung group 1 kasi they were the placebo. So they were receiving the gummy pills. Hindi nila alam na yung tinitake nila is not really a medicine. And then yung group 2, sila yung binibigyan ng metformin. Yun yung gamot na basic na gamot na tinitake ng mga pasyente natin na may diabetes, right? And then yung group 3, ito yung group naman that are receiving intensive therapeutic lifestyle. So, ibig sabihin, they change the lifestyle. Ang goal nila is to lose 7% of those excess weight. Remember, the participants are obese patients. And then, they ask the participants to walk about 150 minutes every week. So, 30 minutes per week yan na physical activity. Now, at the end of the 3 years program, this is what they found. Yung first group who were receiving placebo, the gummy pills, 29% of them develop full-blown diabetes, and that's expected. 3 taon yun And then, yung second group, which are receiving medication, we are expecting na hindi lahat dapat makaka-develop ng diabetes because they're already receiving the medication. However, 22% sa kanila, nagkaroon pa rin ng full-blown diabetes. Alright? And you will see here, amazingly, yung group 3 who are receiving intensive therapeutic lifestyle, only 14% of them develop diabetes. So, kung titignan natin, this is already a 58% benefit. Just changing the lifestyle and reducing the weight. This is another study that was published in the Journal of Applied Physiology, a Dr. Neil Barnard study. that at the end of 4 weeks residential lifestyle program, now what I'm trying to let you see here is 4 na linggong lifestyle change. 4 weeks. Okay? So, isang buwan na lifestyle change. So, that means they use nutrition, physical activity, stress reduction, enough sleep, smoking cessation. Okay? So, what happened after 4 weeks of lifestyle program, 76% of participants were off their oral drugs. Ibig sabihin, they don't need the medications anymore because their blood sugar were at the normal level already. And then 44% were off their insulin for those who were taking insulin shots. This is one of the earliest study in diabetes. This is a study conducted by Dr. Inder Singh. Now, meron siyang 80 patients who are taking insulin already. These are patients on insulin. Now, ang ginawa ni Dr. Inder Singh, he placed these patients into 11% calories from fat. Now, normally what we're eating right now is about 35% of fat. Now, in this set of patients, 80 patients were placed into 11% calories with fat. And you know what happened? After 6 weeks, being on this diet, 50 out of 80 were off insulin already. And then, after another 18 weeks in the program, another 18 of them were off insulin. Now, if you look at your screen right now, you will see that this is about 85% success rate by utilizing lifestyle changes only as early as 1955. Now, yung mga pinapakita kong research sa inyo, matagal nang ginawa yan. Recently, in your screen, you will see here, this is the latest algorithm that we use when we manage type 2 diabetes. Okay, 2019 ito nilabas with the American Association of Clinical Endocrinologists and American College of Endocrinology. You will see here in the pre-diabetes algorithm, ibig sabihin ng pre-diabetes, they're not full-blown diabetic yet, but hey, take note, you don't have to have full-blown diabetes to develop complications. Kasi maraming matagal ng pre-diabetic and then right now full-blown diabetic sila, but they have the complications already. So that's why we already have the algorithm now na kailangan i-manage yung pasyente kahit nasa pre-diabetes stage pa lang sila. Now, you will see in this algorithm, top of the line, number 1, nandyan sa taas, lifestyle therapy. Okay? Again, this is 2019 algorithm. Yung pinakita ko sa inyo earlier in the researches were done 1955, 2003, 2002. Now, this time, in this management guideline that we have, 2019, lifestyle therapy is number 1 in terms of managing patients with pre-diabetes. Ito naman yung sa glycemic control. You will see here, again, for patients who are already diagnosed with diabetes, you will see their lifestyle therapy, which is first in the line. So, again, the researches that are done this time in this generation are only validating the researches that were already done prior. In that guideline that I showed you, you will see here the composition of the lifestyle therapy. Now, in this time, this is already the American College of Endocrinology that is describing kung ano yung gagawin doon sa treatment for diabetes. This is the same thing that those people in the old times were doing. Pareho lang ang binigay nilang recommendation. First, nutrition. Number 2, physical activity. Number 3, sleep, behavioral support, and smoking cessation. Okay? So, science before is being validated by science now.
Although we can see that there is a difference between implementation and how intensive is lifestyle medicine intervention implemented to patients with diabetes in the studies before and in the guidelines implemented now.
Okay? So, here, let's start with lifestyle intervention 1, which is nutrition. So, what we usually give to patients with diabetes, kailangan lower caloric intake that will result to weight loss and improve the A1C. Okay? O ito yung test na ginagawa natin for diabetes. Total caloric intake. As long as you're eating whole food plant-based diet, it's really hard to overeat. Diba? So example, if you eat potato, patatas, how can you even finish 5 large potatoes in one sitting? Mahirap, diba? Yes, you may consume 5 large potatoes in 5 days maybe, 3 days maybe. But in one sitting, you can easily finish 1 tube of Pringles, right? Yung 1 tube of Pringles having about 1,000 calories is just the same of the calories you will get from those huge potatoes that you may be able to finish for 3 days, 5 days. Pero yung isang Pringles, yung isang potato chips, isang upuan mo lang, wala pa isang oras, ubos mo na yan. And that is calorie-laden food. Okay? So that's why in whole food plant-based diet, mahirap mag-overeat. Okay, I'll give you another example. Very classic. If you eat unpolished rice, this is brown rice, 1 cup of unpolished rice, halos hindi mo maubos. But if you eat refined rice, which is white rice, yung isang cup, kulang na kulang. Okay? Parang hindi umabot sa tiyan. Parang kailangan pa ng another 1 or another 2 cups for you to get filled. So that's how important it is to eat whole food plant-based diet, specifically in patients with diabetes. Why? You will see in the screen right now that whole food plant-based diet improves insulin sensitivity, the health of your beta cells, it normalizes angiogenesis, it lowers the overall endothelial cell injury that was brought about by increased blood sugar. Okay? So why are we talking about whole food plant-based here? Please take note that plant-based diet is totally different from whole food plant-based diet. Okay? Ano yung difference niya? Again, potato chips is plant-based. It's vegan. No? Pero yung whole food plant-based is patatas. Alright? Nakita niyo yung difference? So, yung kamote Q, how do you say it? Diba yung kamote, piniprito nilalagyan ng asukal. So, yung kamote Q or kamote chips, whatever you call it, that is still plant-based food, right? But it's processed. But the kamote na nilaga, that is whole. So, anong difference nila in terms of calorie? Few slices of this kamote with all the sugar and all the oil in there is totally higher than the calorie you will get from 1 piece of that kamote that is boiled. Okay? So, I hope that's clear. Now, with lifestyle intervention, we really wanted that patients would take more of the fiber. You will see here that increasing fiber intake will improve glycemic control, will enhance insulin sensitivity. Of course, it will decrease cholesterol kasi yung ating mga soluble fibers, they bind with the cholesterol. Okay? Para hindi lahat ng cholesterol na kinakain mo makakarating doon sa blood. And of course, it improves satiety. Remember that fibers absorbs water. So much so that when it reaches your stomach, it actually expands. Kaya parang mas nabubusog ka. When you take food or plant-based food that are high in fiber. Now, let me emphasize one thing here with diabetes. Remember, in diabetic patients, there is impaired angiogenesis. Okay? Yung angiogenesis, in fact, this is the development of new blood vessels. Halimbawa, nagkaroon ng injury, dapat nagkakaroon ng new blood vessels there to promote healing. Pero ito yung nawawala sa mga pasyente na may diabetes. That's why they have the increased risk to have poor wound healing. Meron silang peripheral neuropathy, meron silang diabetic retinopathy, meron silang renal disease. Some of them may develop cancer, and some of them may develop cardiovascular disease. I don't know, for whatever it's worth. For patients with diabetes, ang kailangan lang talaga ibaba yung blood sugar the soonest you can and maintain them. Okay? So lahat ng complication na pinag-uusapan natin is not totally worth it. Alright? So, these are the foods that may optimize angiogenesis. What you can see in your screen right now includes many of the food na meron tayo na makikita natin locally. Okay, so it includes bok choy o pechay, cauliflower, broccoli, nandyan din yung soybean, tomatoes is also included, all the berries, pineapple, apples. But of course, if the patient is having increased blood sugar, yung timing ng pagkain, of course, ng fruits, especially if they are sweet, they should be taken more in the morning kasi mas active sila. No? And less at night dahil matutulog na lang sila. Now, number 2 lifestyle intervention is physical activity. So this is quite simple. When we say physical activity, if diet works with diabetes, physical activity works the same with diabetes. So basically, this is only 30 minutes moderate physical activity with strength training 5 days in each week. Again, you just have to do the talk test. Ibig sabihin kung ano yung ginagawa mong exercise, as long as you can still talk and you can sing, that is actually low intensity physical activity. Pero kapag hindi ka na makakanta, you can still talk but you cannot sing anymore, you are at the moderate intensity of physical activity. But let me emphasize, sa mga pasyente na may diabetes, nagdadagdag po tayo ng strength training. Ano ibig sabihin ng strength training? Kailangan po may weights. No? So, pwede mong gamitin yung body weight mo or you can use improvised weights that you have. Why? Because when the muscle is contracting, no, pag nagko-contract yung muscle, it utilizes glucose and it helps insulin sensitivity. Okay? So that's why in patients with diabetes, we never allow them and we really discourage them na wala silang ginagawa more than 2 days. No? Kasi maganda yung effect ng physical activity to the insulin sensitivity. Okay? So again, 30 minutes moderate physical activity with strength training or weights, 5 araw sa isang linggo. Okay? Now, you will also see here the next lifestyle intervention, which is stress management. Now, any person who is stressed may have increased stress hormone. And an increase in stress hormone may increase blood sugar as well. So, in fact, a lot of study would show you that stress management improves long-term glycemic control. Okay? So, pero kung nakikita nyo dito sa screen ninyo ngayon, you will see here another factor. We encourage patients with diabetes to have outdoor activity. Okay? Outdoor activity. You will notice right now, specifically for those patients living in the urban area, we have this what we call NDD or the Nature Deficit Disorder. Yung mga nakatira sa syudad. May pangalan na siya ngayon, Nature Deficit Disorder, because we are bound in the 4 corners of this building, nasa walls lang tayo ng mga bahay natin, and in fact, we are living in an artificial jungle. Ano ibig sabihin ng artificial jungle? Nasa syudad ka, ang daming mga buildings na nandyan, you're in the artificial jungle. So a lot of patients right now are having nature deficit disorder. Now there is this pyramid that we have that I showed you. Nakikita nyo sa screen nyo ngayon. This is nature connection pyramid. What do you do? Okay? So here, as advice, daily, there should be outdoor nature play. Ibig sabihin, pwede kang pumunta sa garden mo, mag-garden ka everyday. Next is nature exploring weekly. So, ibig sabihin, nature walk, you may visit places once in a week. And then monthly, you can go monthly outing, you know, with your regional, kung saang farm na pwede mong i-visit. And then yearly, you can go, pwede kang mag-visit sa wild, go to the mountains, or go to the lakes, go to the beaches, etc. You recharge yourself with the nature. You reconnect with nature. So check this out. We call this nature connection pyramid. And then lastly, in managing stress is rest. Okay? When we say rest, a patient should have enough sleep, 7 to 8 hours kung actively working ka. Because it's only during sleep that our cells can recuperate. Remember, pag hindi tayo nakatulog, our body recognizes and interprets inadequate sleep as stress. Okay? So, pag hindi ka nakatulog, the night prior, the following day, cortisol hormone is high, blood sugar is high. Okay? So, in rest, it's not only enough sleep. So, we included here Sabbath in the rest. Now, when we say Sabbath, this is a single day in the week that you are resting together with the Lord. You know, personally, I can't imagine myself without Sabbath in a week. So kahit ang nature goes with the Sabbath, goes with the day of rest. In fact, in organic agriculture and natural farming, we call this fallow. Ibig sabihin ng fallow, when you farm the land for 6 years, on the 7th year, you have to have it rested. Hindi mo siya tataniman. So it can fully recover. So yung mga organic matters mag-develop. So that is happening in nature. It is written in the Bible. It's in the scripture. And your body needs it too. Okay? So that's included in rest. Okay, so I want to emphasize here some other added benefits that you will have in lifestyle intervention. These are the last few slides. First is we are protecting your pancreatic beta cells. Remember, I told you earlier, when you are diagnosed with diabetes, most probably 50% of your pancreatic cells are not already functioning very well. Pag hindi mo pa na-control yan over time, about 20% of that nadidegrade din. So what we do with lifestyle intervention is to protect your pancreatic beta cell to function very well. Next, in lifestyle intervention, you are not only improving glucose, you're not only improving blood sugar, but we are also normalizing the lipid profile. Yung ating cholesterol bumababa din. Yung lipid profile natin bumababa din. And then, there is also down-regulation of inflammatory processes. And that is one of the most important thing that is happening when you have lifestyle change. Yung inflammation sa katawan natin bumababa, basically because you're reducing your weight, you are having anti-inflammatory diet as well. And then lastly, it stabilizes your immune system. Remember, diabetic patients are considered immunocompromised because the glucose hinders the function of the immune cells in general. So when we have lifestyle intervention, when you improve your lifestyle, when you are a diabetic, it stabilizes your immune system in many different mechanisms. Okay? Now, lifestyle intervention reduces pain, secondary to peripheral neuropathy. It improves diabetic retinopathy. It will also help you overcome with food addiction and food dependency because this is the problem of patients with diabetes. With lifestyle intervention, it helps you reprogram your taste buds. And it will help you naturally detoxify your body as well. And then lastly, dun sa dalawa na added effect when you have lifestyle intervention is that it is cost effective. Wala naman po siyang gastos. Okay? You don't spend anything here. In fact, mas makakasave ka pa. No? Specifically, when you change into whole food plant-based diet, you will realize that your expenditure with food will totally decrease. And then lastly, this is sustainable. Okay? Since this is cost-effective, not much of an expense, of course, this will be sustainable. All right? So I'd just like to summarize here. How do we disarm diabetes? First, we have to eat whole food plant-based diet with low saturated fat and high in fiber. Pangalawa, regular moderate intensity physical activity with strength training kasama yung weights, 30 minutes 5 araw sa isang linggo. And the next, quit smoking. And the next, stress management, which includes adequate sleep, outdoor activity, and rest. Now remember, diabetes is the mother of all disease. What we see right now is that diabetes is affecting both young and old. Walang exempted. The youngest patient I have with diabetes type 2 is 11 years old. Dati, diabetes, you can be at your 40s. Now you can be at your 14. So diabetes is affecting both young and old, basically because of the lifestyle that we have, the lifestyle and the routine that we do every single day. But one good news here is that we can do something. If this is lifestyle related, we just have to modify our lifestyle, learn about lifestyle modification, educate yourself, and then start living a healthy lifestyle. Always remember that living a healthy lifestyle is the cheapest way of giving yourself a good health care, because having a disease right now may be a disaster.
Today we will have this Teaching Kitchen episode, and I am Dr. Michelle Palma. Together with me is my assistant, Margaret. Today we will be learning some of the recipes that we will teach you. This is repurposing food. Again, when we mean repurposing food, is that using your food as medicine. So I promise that today we will be preparing some of the foods that we used to eat. It's just that we will be giving you healthy substitutes. Alright, so as you can see in our table right now, we will be preparing 4 recipes. Okay, so now we will be making banana blossom patty. This is a very nice substitute for any burger made of meat. Okay, so this has no saturated fat, and this is full of fiber that is really absent in any burger patty that you can find in the market. So our ingredients here are the following. We have 1 cup of banana blossom cut. This is fresh banana blossom, and this time of pandemic, you can actually keep your banana blossom. I had this for over 2 months already, and it's in my fridge, and it's still good, and we can still use it. So here, first we have again 1 cup of banana blossom, and then we also have 1 cup of oatmeal flour. So it's very easy to create your oatmeal flour. You just have to put your oatmeal, whatever source you have in your pantry this time. It can be your quick cooking Quaker oats, or it can be your rolled oats, okay? So you just have to put this in your food processor and then blend them, okay? So until you get the consistency like that of a flour. And then we also need 1 tablespoon of spring onions chopped. We also need 1 tablespoon of tomatoes. This is diced tomatoes. And then we also have here 1 tablespoon of onion, diced onion. And then we have 1 tablespoon of garlic, minced garlic. And of course, we have a bit of a water, okay, just to have the good consistency of the patty that we need, okay? So we only need a bowl like this to mix all the ingredients, and then we just have this spatula to mix all the ingredients. All right, so Margaret, maybe you can help us out. So here you just have to pour banana blossom, and then next here is our oatmeal flour. Okay, thank you. And then we have the spring onions, everything there. Okay, and then we have the tomatoes, and we have the onion, and we have our garlic. Okay, so this is very easy. Just give it a good stir to combine all ingredients. And then this is the right time for us to add our water. Okay, good. So you just have to look at the consistency if it's already okay with you. If it's not, then you can add more water into it. And then this is the right time for us to add Then the rest of the ingredients, which is black pepper and then salt, just to season it. Okay, so here we season it with black pepper. Sometimes it's really nice to have your patty a bit spicy, so you can use your black pepper to do it, and then season it with salt. It really depends on how salty you want it to be. And then just mix them all together. And now this is ready. So you have two options. You can either throw this to the oven. Of course, you have to preheat your oven to about 250 degrees centigrade and then just place it there. And it will cook depending on how thick your patty would be. It could cook in about 15 to 20 minutes and you're done. So that is zero oil, okay? So no fat at all. But if you don't have oven in your house right now, you can just fry it. You can also use non-stick pan, but if you don't have non-stick pan, then you can put some or a little bit of an oil and then fry them, okay? Like if you have a lot of banana blossom, because there are areas in the Philippines right now that has lots of banana blossom, you can also cook this by batch. All right, so that means you may prepare a lot of this, and then you can also put this in a steaming pot, and so you can steam them, and then you can preserve them in the fridge. It can stay for over a month. So here we have the patty ready, and then we will put this in the oven. Or another thing is we can fry this over the pan. Alright, so while our burger patty is in our oven, while waiting for it, this is the right time for us to prepare our vegan mayo. Okay, so the only ingredients that we will be using, first we have 2 blocks of tofu, and then lemon. We wanted the juice, 2 tablespoons of brown sugar. This is optional. Whatever kind of sweetener you may have, you may use your honey, agave, or maybe dates to also do. And then we also have dash of black pepper, and then we also have 1/2 teaspoon or 1/4 teaspoon of your salt, depending on the saltiness that you like. Okay, so in this recipe we only need a bullet blender, or any blender will do. Okay, so we just have to put our tofu here in our bullet blender. So ideally we have to if your blender is not industrialized, then you have to mash your tofu first, although this is not really so firm and it can be managed by a bullet blender. So you can always buy your tofu from the wet market. You can buy this from the grocery store, or if you want, you can also make your own tofu from scratch. So watch out for the upcoming episodes that we have in our teaching kitchen, because we will be teaching you how to make your own tofu at home. So this vegan recipe is so simple. Once finished, you can store this in the fridge, and this can stay for over 2 weeks, sometimes 3 weeks, depending on the temperature that you have in your fridge. Okay, so we have our tofu here right now, and so we just need our lemon juice. So approximately you will be needing about 2 tablespoons of your lemon juice in this recipe. So this will provide you the sourness. Okay, next here is we just have to add our sugar. And then, of course, our black pepper and our salt. Now, we also have here optional ingredients. We have here nutritional yeast. This will give you the cheesy-like taste. If you don't have this in your pantry, that's not a problem. Again, like I said, this is optional. So you can put about 1 to 2 tablespoons of this. And then another optional ingredient here is oil. You may use olive oil, extra virgin oil, pomace olive oil if you are intending to make this stay for over 3 weeks. But if you're going to use it right away, then you don't need to put oil. Okay? So in this time, I'm not going to put oil. And then another ingredient that we may use here is plain mustard. Okay? So if you want that bitter taste in the vegan mayo, then we can add mustard to it. Then we just have to throw this in the blender. Let's check. So this is just the right texture that we want for a vegan mayo. Okay, so after 15 minutes, our burger patty made of banana blossom is already ready. So again, like I said earlier, you can cook them over the pan or in your oven, okay? So here we have our banana blossom patty. Okay, so you will see the consistency when it's cooked in the oven. It's kind of dry, but if you want it to be juicy, then it has to have some oil, right? So, but we're getting rid of the excess oil. So the best method of cooking is putting them in the oven. All right. So here we will be making the clubhouse sandwich. So of course we will be needing the bread, and then we have the lettuce with us. And then you can also put some onions and then your tomatoes, or if you have some cucumbers, you can use them as well. All right. So, and then we will be needing the vegan mayo that we just created earlier. So here's the vegan mayo that we made earlier. So we need this in creating our vegan clubhouse sandwich. All right. So first we just have to assemble. We have here our bread, and then we just have to put the vegan mayo. Just put your desired amount. It can be as thick as you want or as thin as you want. So there are some options where you can improve your vegan mayo. You can also add some cucumber relish if you want to add some sweetness to it. But this one, plain vegan mayo, is already good enough. All right, so we just have to put there the mayo, and then the next thing is to put our lettuce. Margaret, maybe you can put here the patty. One patty over there. There you go. And then you can put some tomatoes. And then the onions. One more. All right. And then another pair of bread with the mayo. And this is so simple. Put it right there. Okay, and then we just need to cut the sandwich. This is optional again. If you're gonna eat them as a whole, then that's not a problem. All right, and then we can serve it here. So there you go. We have our clubhouse sandwich. The next recipe that we will make here is a very simple sweet potato wrap. So we have a lot of variations in serving your salads, remember? So sometimes if you eat salads 3 times in a day, it's really necessary to have some strategy and to be artistic enough on how to use those ingredients and how to feed them to your family. So this is one very simple way to tweak some of those recipes. So you just have to have all the salad ingredients you have and put them in a wrap. But where do you get your wrap? Usually we buy it from the department stores or from the grocery store, right? So all of those has, of course, they have preservatives because just to have a long shelf life. But again, you can make your own wrap in the house, just having 2 ingredients. And what we have here is any type of sweet potatoes, and then you have your oatmeal flour. Okay, so it's just like the oatmeal flour that we used earlier. Now, if you don't have oatmeal in the house, then you can use any types of flour that you have in your pantry. Okay, so basically we just need equal portion of your sweet potatoes and an equal portion of your oatmeal flour. All right, so we just have to put our sweet potato here, and then we just have to mash it. Now remember that the sweet potato should be boiled so that we can reach a soft consistency as much as possible. It has to be soft and not dry. All right, so you just have to mash the sweet potato first before you add your flour or your oatmeal flour. you're eating this kind of wrap, Margaret, right? So here, this is just ready. And then we add same proportion of your oatmeal flour. And then if you think you need some water to be added, then you can add some water. Alright, and then the next thing that we're gonna do here is to knead the sweet potato mixed with our oatmeal flour. Okay, so I think we just reached the right consistency, and this is ready as a dough. Alright, so in this stage, we need our hands here. Okay, you just have to make a dough out of it. Alright, so we already have the dough here. You just have to make a good consistency of your dough. And then, of course, we will be needing your board and, of course, your roller. And we will be also needing portion of your oatmeal flour because we have to make a shape of a wrap. So I'm only making one wrap here. And we need the roller. So you just need to dash some of your flour on the board so that it won't stick on the board. And then until it reaches a consistency of about 2 millimeters thin, okay? So it's just plain and simple. We don't add any salt, we don't add any sugar, no preservative at all, just 2 ingredients. No oil at all. So again, like I said earlier, if you think your sweet potato is a bit dry, then you have to use water. But in this case, it's just okay. And so as you can see, we didn't add any water. So be careful not to add too much of a flour. Otherwise, your wrap will be hard, you know, when you cook them. So we want it soft as well. Okay, so here, just about 1 to 2 millimeters thin. And then we have to throw it in the pan and just cook it right there. No oil at all. So when we put it in the pan, we just have to make sure that we have to flip it every 1 to 2 minutes. So here you can choose to use your non-stick pan, or any stainless pan will also do. Okay, so this is the way you cook your wrap in a low temperature. Most probably in about 1 to 2 minutes you will be flipping it over, and then in about 5 minutes you will be done. Okay, so but if you want to make a potato chips out of the same ingredients, then you can chop this into whatever forms you want and then put them on the pan and then just cook them the same way. But this should be longer, all right? So until we reach the consistency and the crispiness that you want. Okay, so we have here finished product. So we have here the sweet potato wrap, and then we also have the sweet potato chips. Okay, so this time we will assemble our salad wrap. So we have our sweet potato wrap already ready here. So earlier we made our vegan mayo, if you remember. And so another ingredients that we need here are diced tomatoes and then diced onions. And then we will be needing our seaweeds here, and then our lettuce and any leftover viand you have in the house. So this one I have here, this is vegan afritada. So this is made of gluten, but you can also use the banana blossom patty that we had earlier. You just have to chop it into small pieces so that we can add this into our salad wrap. Okay, so we just have to assemble. We have here our sweet potato wrap, and then we just have to put here our mayo, just enough. Okay, so just spread it around. Okay, and then we just have to add our tomatoes, and then our onions. So for kids, they don't really like onions, so you can skip them. And then we just have to add our seaweeds here. So this will add up umami taste in your wrap. And then of course we have to put our leftover any vegan viand that you have. So if you have tofu, then you can use tofu. If you have your like the banana blossom patty earlier, we can use them as well. And then lastly, we can put our lettuce over. So you just tear the lettuce right size, and then we just have to wrap it. So you can also use a toothpick to keep the wrap. As simple as this. There you go. We have our salad wrap. Okay, and the last recipe for today is mulberry juice. So we have very simple ingredients, again, coming from our own garden. Okay, so except for one, which is lemon. So we have here lemon juice, we have the mulberry, the fruits, and then we have mint from the garden. It really depends on how minty you want it to be. And then this is an additional and optional ingredient. Any form of sweetener will do. If you have honey, you can use honey. You can use brown sugar, muscovado, cocoa sugar, or no sugar at all. Okay? So we will not use sugar. So all you need to do is to put some water in your blender, and then we just have to add the rest of the ingredients. Okay, so we just have to put our mulberry. Of course, you just have to wash it first and then put it here. You can put as much as you want because this is already sweet as long as you harvest them right. Okay, so there you go. We have our mulberry, and then we can add some mint leaves, fresh mint leaves. Again, this can be optional because you may not have your mint at home right now, but I really advise you to plant some mint. It's really easy to propagate this. You just have to buy one pot, and then you just have to cut and then plant them, and it can propagate very easily. Okay, so we have just enough mint here, and then we have our lemon. So we squeeze the lemon juice. All right, and then we throw this to the blender. Again, if you want your sweetener, you can add any sweetener. But in this case, we're not using any because our mulberry here is already sweet enough. Okay, you just have to blend like about less than a minute, and then we're done. So just remember, whenever you prepare your juice, you have to consume it right away. Or otherwise, you have to add some ice to preserve the antioxidants, to preserve the anthocyanin that has in it. Okay? Okay, so here we go. This is our mulberry juice. You can easily propagate your mulberry tree. You just have to find the cuttings, and then you just have to plant it. In less than 6 months, it will give you very nice fruits, and this will be whole year round. So here you go, your naturally produced mulberry juice. Always remember that living a healthy lifestyle is the cheapest way you can provide yourself the best medical health care. Consider taking your baby steps towards a healthy behavior change because having a disease can lead to crisis and potential disaster. We'd like to see you again in our next episode. Quality Life, your choice.
Mao kato ang atong episode karong adlaw mga ka-friends. Sa atong duha ka episode, hinaot nga ato pagahingtungan nga ato nagkul i-prioritize ang atong lawas, ang atong health, di ba? Kay mag-unsa man ang atong mga pagpaningkamot sa kinabuhi ug ang atong mga bahandi kung ang atong lawas na mismo mao ang surrender. Ayaw kalimti pagtubag sa atong mga pangutana pinaagi sa pag-message sa atong Facebook page, ACI Northern Mindanao. Kining atong program sa AgriTalk 2021 is in partnership with the Department of Agriculture, Agricultural Training Institute, Manila Bulletin, and Smart Communication. Daghang salamat sa atong resource person, Dr. Michelle Acero Palma. Ug mga friends, magsugod na di ay ang atong Agristuryahay sa ATI Webinar Series matag ikaduha ug ikaapat nga Biyernes matag bulan. Ang unang episode mao ang bahin sa African Swine Fever. Ang sakit sa baboy nga usa sa mga hinungdan nganong misaka og kalit ang presyo sa karne sa baboy sa atong merkado karon. So magkita-kita ta sa atong karong February 15, 2021 Biyernes dinhi gihapon sa atong Facebook page sa ATI Northern Mindanao. Ang pinkanunay, sunod sa social distancing, let us wash our hands always and wear our face mask and face shields. Keep safe and may God bless us all. Happy Friday!